So I call on Deputy Brendan Griffin to introduce his question number 9.
Thank you very much, Lascan Corla. The question is in relation to the need for a dedicated obstetrics theatre at Kerry General Hospital. At present, there is no dedicated obstetrics theatre in the hospital, and mothers who need surgery in labour at the moment must use the regular theatres. And if they are not available, they must wait. And that is a particular difficulty in instances where there is an emergency, where a C-section is required within minutes immediately. And in that scenario, for example, where a baby is in distress, we just simply can't afford to wait, and there is a continued risk of catastrophic brain injuries and other related complications as a result of not having the dedicated theatre. So, Minister, I acknowledge you have visited at my request earlier this year, and just want to see if there is an update on the request for this very, very required and this very much needed piece of infrastructure for the hospital.
Much is being done to further improve maternity services across the country. Additional funding of £2 million provided in 2015 is being used to fill frontline posts. In 2016, the HSE will again focus on maternity service improvements and implement managed clinical maternity networks across all hospital groups. The establishment of such networks will ensure that smaller maternity units, like Kerry, will be supported to provide high-quality, safe services. An example of this initiative, which was recently established, is the Memorandum of Understanding agreed between the Coombe Hospital and the HSE to establish a managed maternity network within the Dublin Midlands Hospital Group. This will provide a single maternity service operating over 2 sites led by the Coombe, and this arrangement will serve as a model for other hospital groups. We now have more midwives employed than ever before in the state, 1,438, which is an increase of 228 since the government came to office in 2011. And similarly, there's been an increase of 5 in the number of consultant gynaecologists and obstetricians, which represents an increase of 10.94 whole-time equivalents. The HSE is also establishing a National Women and Infants Health Programme, modelled on the successful National Cancer Control Programme. The programme will span obstetrics, gynaecology and neonatal services across community, primary and secondary care. This represents a fundamental reorganisation of maternity service governance structures and will, I hope, ensure the delivery of safe, high-quality, sustainable maternity services. A recruitment campaign for the programme's management team, comprising a programme manager, clinical director and director of midwifery, is now commenced. In addition, my department is currently developing the country's first national maternity strategy. This will provide a policy framework for the Women and Infants programme and strategic direction for the optimal development of maternity services to ensure that women have access to safe, high-quality maternity care in a setting most appropriate to their needs. I've identified the publication of the strategy as a priority for this year. Additional funding is being made available for the further development of maternity services in 2016. The use of this funding to further develop the quality and safety of maternity services will be finalised in the coming weeks in the context of the HSE's National Service Plan for 2016. I am aware that staffing requirements for a dedicated obstetric theatre have been identified by Kerry General Hospital, and this is being considered by the HSE in finalising its priorities for the 2016 Service Plan.
Deputy Brendan Griffin.
I very much welcome the fact that the requirements by the hospital are being considered, and I would absolutely urge you to use any influence you have to prioritise this matter, because it is one of huge importance to the county of Kerry and all of the women and their families who were using the maternity services there. And can I just say, I suppose I have an interest in this as someone who has been in the maternity ward twice in the last 2.5 years in Kerry General Hospital. I must highly commend the efforts and the work of the very dedicated staff that work there and the brilliant work that they do, but they need support, and they need for government and the HSE to help ensure that there are no other very sad cases which unfortunately have occurred in the past, and we need to do everything we can possibly do to ensure that this doesn't happen. Just on the matter of Kerry General Hospital, I want to acknowledge today, I think it would be remiss of me not to acknowledge the many developments that have occurred under the current government in recent years, such as the new endoscopy unit at the hospital, the new cardiology unit, the new medical assessment unit at Kerry General, the 4-bed high observation unit as Minister Lynch would be aware of. There's a new CT scanner for €700,000 currently being installed. The Friends of Kerry General Hospital have recently bought a bone density scanner, and enabling works are ongoing at the moment to install that. And also works have commenced on the new diabetes daycare centre.
Thank you, Deputy. This is question time, Deputy.
Very good, but I think it would be remiss if we not acknowledge the positives.
I don't know, the Minister wants to reply?
We need to keep developing these things, and certainly the obstetrics theatre would be very welcome.
Does the Minister have any reply?
Yeah, no, I just wanted to welcome Deputy Griffin's comments. I had the opportunity to visit Kerry General Hospital with him and Mr. Deanahan some months ago, and I was very impressed by the performance of the hospital. It has its problems like every other hospital, but it's going well in so many ways, and it was very good to meet the staff there and see the important work they're doing. The requirement to open a second on-call theatre team would require 10 additional nurses and 4 additional doctors. And of course, even if that can be funded, there can often be difficulties recruiting them. But it is something that is certainly under consideration in the context of the service plan.
Come on. Thank you, Deputy.